Welcome to New York Nonprofit Media. I'm Jeff Stein, and I'm here in the CEO Corner with Tony Hannigan, the Chief Executive Officer of CUCS. We'll get into the whole genesis of the name, but thank you so much for being here. It's really great, timely moment for you to be here. A lot of discussion, obviously, in the news about issues that your organization is very active in, homeless services, supportive and transitional housing. It'd be really great to get your perspective on those issues and more. But first, let's talk about CUCS, how it came about, and your story in growing this now $40 million, 400 plus employee organization.
Well, thank you, Jeff, for having me in today. So CUCS is the Center for Urban Community Services. At one time, it was Columbia University Community Services in the early 80s until the early 90s. That's where it was originated. When we spun the organization off as a independent nonprofit, people knew us by the acronym, so we had to back into the and find a name for it. And so that's how it became the Center for Urban Community Services. And it started at the university as an interdisciplinary project among various graduate schools on campus to study the needs of single poor people. The thinking at the time being that there was no real body of literature about single poor people, unlike family and children or the elderly, and not really an understood group. And so that's how CUCS in its original form originated. And we started to do service programs to address homelessness, and as that started to burgeon, we made the decision with the university to spin it off as a nonprofit, and that was in '93.
Right. So speaking about this population that you work with, what do you see as the biggest needs for single poor people in New York right now? Obviously, it's still a very marginalized community 20 plus years later in terms of housing, also in terms of incarceration and re-entering after being incarcerated, and the issues that single people have in pulling their lives back together. How is your organization helping the population?
So the biggest need that we see and have seen for many years is, and this will not be a new word in all these discussions, is housing, affordable housing. People need affordable housing. And what CUCS does is really focus on special needs populations among single people. And so that includes people with mental illness, people with HIV/AIDS, and then also more recently focusing on primary health care issues among that group. So you're absolutely right. They are a marginalized group very often. When they're poor, they're marginalized, and services tend not to be geared towards them. And supportive housing, however, which CUCS was instrumental in helping to bring to the fore back in the early 80s, focused on single people, and it was a unique venture, and so now single people who were marginalized are often thought of as homeless, and that's not entirely true. Not all poor people who are single are homeless. Right. In fact, most are not. But that's where we tend to put our attention. CUCS does, and it's also the general public does.
So obviously, affordable housing, big conversation right now in city government and also in the nonprofit world. What is your organization pushing the government to do on this issue? It's been a lot of news about three-quarter housing and illegal halfway homes. As filling this gap because of a lack of affordable housing for the population that you serve. What do you think the government needs to do to step in and fill holes?
Since Mario Cuomo and David Dinkins, there were agreements called New York, New York, and these are agreements between the city and the state to develop supportive housing. And New York, New York 1 was the first round of that. seeing how successful supportive housing can be with multiple populations, and started out with single people who were mentally ill. There have been 3 big rounds of it, and now there's a New York 4, which is a much smaller round, and that's 5,200 units statewide. It's the first statewide initiative. All the New York agreements have been citywide, and those, one agreement was for 9,000 units, et cetera. This one is 5,200 units, and that will only be 3,900 units for New York City, which is not adequate. And so the community that I work with, the organizations and advocacy groups, we're really pushing for a larger New York 4 agreement, and so it's kind of stuck at this point. The city administration recognizes the importance for New York 4, and we're trying to get everybody to the table for that. And then these other initiatives that are going on about inclusionary zoning is important. If we're going to have a city that's going to be inclusive and and diverse in the full sense of the word, that's a very important initiative. And the 3-quarter housing is something it's like a weed that grew, but now you have people who have been living in 3-quarter houses for extended periods of time, and for some that's home. And I think what we should be doing there is that we should be evaluating, conditions in those, and the city has started that, of course.
Right.
But evaluating those conditions and working with the people who live there to determine where they want to be.
Right.
It wouldn't surprise me if some people are going to want to stay there, and I think if they do, they should be allowed to do that.
Mm-hmm. So in terms of homelessness, as well as a larger issue, it's been a lot about it in the news last week, especially the Post really going after the de Blasio administration for the ballooning size. Some statistics vary. Some people say 56,000 around homeless population in New York City. What do you think is missing from the conversation right now? We hear a lot about mental health, a lot about affordable housing, obviously, but it seems like it's an intersection of a lot of really tricky issues. What would you like to see more of in the discussion about homelessness?
Well, again, whenever asked the question of what's missing, homelessness by definition is a lack of place to live, and so we have to have places for people to live. There's just this, we've had the street counts, and I know the Post has been very critical of those, but we've had the street counts over many years now, and they're not perfect, as the Post pointed out. It was 25 degrees or whatever during the last count, but these are national efforts that HUD really pulls together, the Housing and Urban Development at the federal level, and so at least each year we're comparing apples to apples, and so in the past count we've seen a reduction in New York City, except that we did not see one in Manhattan, but we saw basically a 5% reduction in street homelessness, and we've been seeing a reduction in street homelessness in recent years. Part of that has to do with redoing the way outreach teams, and CUCS has an outreach team, but redoing it citywide starting in 2007, where the focus is on chronically homeless people. So it's determining who's chronically homeless. There's a vulnerability index that we use that goes to the length of time homeless, problems that the person has. They get priority, and so now why all this focus? I think part of it is homeless. There's an invisibility about homeless people, and now the press about them is making people see them again.
Right.
So there's that effect. And there may be differences in the way that the previous administration, this administration, handles encampments and so forth, where homeless people congregate. It's a different police commissioner, it's a different mayor, but whether or not there's actually more homeless people on the street, you could look at the variables and say perhaps, right? I mean, if you compare the census at Rikers this year, same time this year compared to last year, it's down about 10%.
Right.
Right, and there's a big overlap between people who were in shelters and on the street, people at Rikers. So there are these variables of different streams that come in. As a person who works with homeless people and has done, I've been doing this for 30 years. I would like to see the goal of ending street homelessness, having what we call functional zero. I mean, there's always going to be some people who are homeless, but
right.
But the numbers say that right now, in the last count, there's about 3,200 people living on the streets, and that seems doable. It seems so. Those are people who are not going to stay in a three-quarter house. They're not going to stay in the shelter, and we may not be able to achieve it, but in the long range, it seems to me that would be an aspirational goal. Is to have that kind of an impact, and the reason I think it's possible is during the tenure of one commissioner, Rob Hess, who has since passed away. He was very interested in street homelessness, and he came from Philadelphia, where he was in charge of homeless services. And he's the one who really led the reformation of the way street homelessness was done, focusing on chronically homeless. But what he also introduced was he introduced safe havens. And safe havens are transitional residences located in the community. And it could be as simple as a YMCA. Where you and so now outreach teams get money for this. And if you were homeless, I would say to you, I'll rent you a room at the Y, and you might say, well, what's that about? And no strings attached. We'll rent you a room at the Y. And then what follows after that is befriending that individual, learning about them, and then of course trying to get them on the path towards permanent housing. And so that particular intervention was very effective in helping street outreach teams to do their work. And it's better for everybody, right? It's better for the person who's not on the street. It's better for the general public. It's better for tourism.
Right.
And so I would think that would be an admirable goal. But
maybe as a final question, you're leading. We're joking about the distinction between mid-size and large size, but by any measure, quite a large organization, 400 employees and a large budget. What is your perspective on leading that size of an organization and also navigating the tricky relationship at times between state and city government in terms of contracts and also foundation funding, private sources of funding that are always necessary as sort of stopgap measurements in the budget?
Well, when I got into doing this, I sort of got into social work. It was serendipitous that I got into social work, and I grew up in a New York City housing project, and so I came, I guess, kind of pre-packaged with sensitivities about the issues that low-income people face, and so for numerous years was very close to the action, in terms of working with people, now running something of this size, it's like being a captain of a big boat,
Right.
So you can't wind up on the shoals, and you have to understand where the bay is deep and where it's not, and so I enjoy really enjoy the work. I enjoy working with government. I think CUCS has very good relationships with government. I think because we do a good job. Similarly with foundations. Some have called us the gold standard of homeless services and mental health services for this population. We're very proud of that. And most important, CUCS has a terrific staff. It really does have a terrific staff. And I've been with CUCS, as you know, since back with Columbia, but many of CUCS's staff are Chief Operating Officer has been with us for 25 years. Our Associate Executive Director, Deputy Executive Director, he has been with us for 25 years. Our Chief Program Officer has been with us for that many years as well, and the list goes on.
Right.
So we have stuck together as a team, and I think that's part of our success.
Great. Well, thanks so much again for coming in and talking with us today. Very enlightening.
Oh, thank you.